Welcome to Embracing the Difference Globally, the Ability event. Session 2 will begin shortly. We would like to just take a moment to thank our partners this year. Rehabilitation Counseling Program from St. Cloud State University, St. Cloud State University Special Education Department, Hamlin University, Metropolitan State University, and Normandale Community College. We joined the event in progress due to lost footage. Andrés is answering the first question. Could you tell us about the National Council on Disabilities' mission, history, and disability advocacy work?
It passed an amendment to the Rehabilitation Act in 1973, and that's what formally created the National Council on Disability, and that's what gives us our statutory authority. In 1984, we became an independent federal agency. Congress then charged the National Council on Disability to review and evaluate on a continuing basis all federal policies, programs, and activities concerning people with disabilities, and to report on its activities. We are an independent federal agency. Today, we are charged with advising the president, his administration, Congress, and other federal agencies regarding policies, programs, practices, and procedures that affect people with disabilities, not only in our country, but in our territories as well. Finally, we are comprised of a team of presidential and congressional appointees. We have 9 council members, and we are supported by an executive director that's appointed by the chair and a full-time professional staff of 12 very talented and dedicated individuals that assist us on a full-time basis.
That's amazing. Thank you. Okay, so the next question, can you share with us your story and let's see, okay, sorry.
Okay.
Yeah, can you share about your story and how you personally became involved with the NCD, serving as their current chairperson?
So, Jordan, as I mentioned in the introduction, I am a person with disability. I was involved in a horrific car accident in November 1996, resulting in quadriplegia. At that time, I was just 3 years into my legal career, and I thought naively that given the excellent care that I received for the 5 months that I was in the Rehabilitation Institute of Chicago, learning the new me, that I'd be welcomed within any hospital, any doctor's office throughout the country. And what I found was that I was grossly naive in that the healthcare system then and now has largely been failing people with disabilities. And so I focused my legal practice from what was once a corporate practice and business practice to advocating and protecting the rights of people with disabilities, not only here in the Chicago area, but throughout the country as well. And it took me a number of years really to embrace the fact that I had a disability and that I identified as being someone with a disability. But I started working closely with a Center for Independent Living called Access Living. Access Living is one of 400 centers for independent living throughout the country, and their job is to advocate for the rights of people with disabilities, but also to empower people with disabilities within their community to live a full and independent life, and self-directed life. And my work with Access Living really allowed me to come to terms with my own disability and be comfortable with my new reality. And I really learned to embrace not only having a disability, but being proud now to be a person with a disability. And that was important because in 2010, the National Council on Disability convened a healthcare summit in Washington, D.C., from which the council developed a seminal report on the current state of healthcare for people with disabilities. At that time, the council was comprised of 15 council members. The meeting was enlightening not only for its subject matter, but it was convening of advocates from all across the country that had particular expertise in addressing healthcare disparities and healthcare accessibility for people across all categories of disabilities. So looking back, I would not have known then that 8 years later, from a delegate to a convening of the National Council on Disability, that I would become a member of the council, let alone 11 years later be designated as its chairman. In 2018, there was a vacancy on the council, and Senator Chuck Schumer from New York had the ability to appoint someone. The president appoints 5 members of the councils, and the majority and minority leaders of the House and Senate are able to appoint 1 person each. Senator Schumer then asked Senator Duckworth, my senator from Illinois, if she had someone in mind. And at that time, I was serving as chairman of the board of directors of Access Living. And our CEO then was Marka Bristow. She had a close working relationship with Senator Duckworth, and Senator Duckworth was a good friend of Access Living. And so that was the connection. Marka Bristow asked me if I would be interested, and I was absolutely interested. Sadly, we lost Marka 2 years ago, but Marka herself was previously the chair of the National Council on Disability under the Clinton administration. And so that's a long way of saying how I became involved with the National Council on Disability.
That's amazing. Thank you for sharing that with us. The next question, from your perspective and experience, what are the areas of greatest challenge still today for individuals with disabilities that NCD is working to address?
So given the times that we're in, it's foremost healthcare. At the National Council on Disability for decades, we've been stating that attaining and maintaining good health is critical for everyone, certainly more so for people with disabilities. It is truly the predicate to our ability to live, our ability to learn, our ability to work and earn. And so we have to make sure that healthcare is accessible for people across all categories of disabilities. That pandemic has ravaged our community. People with disabilities throughout the world have been disproportionately affected by the COVID-19 virus, from the high rates of infection, the disproportionate percentage and degree of worse results that we have once the virus is contracted, and our high rate and incidence of death as a result of the virus, all of which was predictable and avoidable, particularly in this country. Predictable given the high percentage of people with disabilities that live in congregate settings. Predictable given the decades of neglect and inattention to the social determinants of health for people with disabilities, like our housing, education, employment, food security, etc. All of which has made us less resilient to be able to respond to the virus once it's contracted. And the sad reality is that today in America, if you're a person with a physical, intellectual, or developmental disability, your life expectancy is less than that of someone without a disability. You're at a higher risk for early onset of cardiovascular disease than those without disabilities. You're more than twice as likely to be obese than people without disabilities. You're more than 3 times likely to have diabetes than those without disabilities. You're significantly more likely to have unmet medical, dental, and prescription needs than those without disabilities. And if you're a woman with a disability, you are likely to receive poorer maternity care and less likely to have received a pap smear test or a mammogram than those without disabilities. And I can go on. The point is that people with disabilities are and report to be in fair or poor health as compared to those who are not disabled. And what's more, we know that these disparities are exacerbated if you're disabled and a person of color. We know this because there's been countless studies and reports over 30 years that well document the recurring theme that people with disabilities in the United States are significantly in poorer health and receive significantly poorer care and treatment than those who are not disabled. The existence and extent of those health disparities often have nothing to do with our disability per se and are often preventable. They have everything to do how physicians see us and how they treat us. Now, we're putting the final touches on a healthcare equity framework for people across all categories of disabilities, which we'll be unveiling here in the next week or so, which calls for the implementation of 30 discrete items across many federal agencies and will require a combination of administrative, legislative, and executive actions to implement a framework that requires an all of government approach to achieve health equity for people with disabilities. In addition, we need to address the significant unemployment rate for working age persons with disabilities, ensuring that we preserve our right to vote and that voting methods are accessible to people with disabilities, ensuring that our civil rights laws under the Americans with Disabilities Act, Section 504 of the Rehabilitation Act 1973, and under the Affordable Care Act are strengthened and not diluted. Jordan, we have a lot to do, but we're small but powerful, and so we think we'll be able to get some things done. We believe that we have the right federal partners presently to really act and make a meaningful difference, particularly in the area of health equity for people with disabilities.
That is so amazing. I don't know if you could see my face, but like I was smiling through a lot of that, and I'm glad that the NCD is out there because some of that stuff I didn't know. So thank you for sharing that. Let's see. The next question says, what has been, let's see. What has been the National Council on Disabilities' role in advocating for the ratification of the UN's Convention on the Rights of Persons with Disabilities? And what has been the NCD's current efforts to seek its ratification? Sorry, that's a mouthful. I hope that made sense.
No, absolutely. So Jordan, nearly 2 decades ago, the National Council on Disability kicked off the U.S. disabilities community consideration of an international treaty. We published a white paper titled Understanding the Role of an International Convention on the Rights of People with Disabilities. So since that time, we have published numerous analysis and reports on the development, signature, and ratification of the Convention on Rights of People with Disabilities. The CRPD offers a vital framework for creating legislation and policies around the world that embraces the human rights and dignity for all people with disabilities. It's a critically important that the United States ratify the CRPD for many reasons that the NCD has been espousing for a number of decades. Ratification is critical to maintain our global leadership role and taking next steps in assisting to eliminate disability discrimination throughout the world. It provides us an opportunity for the United States to continue to play an important role in the development of disability rights around the world without having to change any of our own laws or adding additional costs to our budget. Ratification would build on a proud moment in legislative history when, through bipartisan leadership, Congress passed and President George H.W. Bush signed the Americans with Disabilities Act. And the ADA was the basis of a model for the CRPD, and its values of independence and respect and the concept of reasonable accommodation are echoed throughout the treaty. By the way, the National Council on Disability, we authored the first draft of the Americans with Disabilities Act in 1987. So we have a lot at stake here. We have a lot of pride in a CRPD and knowing that it was modeled after the ADA. You know, if we're able to ratify the CRPD, the United States will offer decades of honed technical expertise to reduce barriers globally and ensure that Americans, including our veterans who travel, work, and study abroad, have the same access that they enjoy here. Without laws like the Americans with Disabilities Act, abroad millions of children and adults are housed in institutions without enrichment of a family life, community resources, or access to the most basic civil rights, like a birth certificate or even a name. Until it's ratified, the United States is simply just a bystander on these critical matters. Jordan, as you may know, there are over 1 billion people with disabilities around the world. 80% of them live, 80% of them live in developing countries. Ratification of CRPD brings us one step closer to the world as we know what it can be and what it should be. And that is making sure that people with disabilities and people without disabilities are treated equally everywhere. But the rights that are embedded in the convention are not new rights. They're the same human rights recognized in the Universal Declaration of Human Rights, the Convention on the Rights of the Child, and other international human treaties. The U.S. is party to over 10,000 treaties and international agreements to which the United States has strengthened its position as a global leader and not weakened it. We again can be a global leader on disability rights and disability issues throughout the world once we ratify the treaty. Now, earlier this year, Jordan, we engaged in discussions with several of our federal agency partners, including the State Department and USAID. And given our current makeup of the Senate, the consensus was that pushing for ratification now would be somewhat futile. We are reassessing our strategies and continuing to have these dialogues. But at the moment, we're not making an immediate push for ratification, but we're seeing what our options are moving forward.
Okay, thank you. It certainly sounds like you have a lot to do. Related to the last question a bit, how exactly is the NCD working with the US Congress to promote the rights of people with disabilities globally? Could you give a few examples, or could you give some examples?
Sure. So over the last couple of years, we again we're assessing whether we could push for ratification, trying to get a sense from our federal partners and what the likelihood would be to move to get the treaty ratified. Absent that, over the last several years, we've focused on making international development efforts more inclusive of people with disabilities. We give a significant amount of foreign aid to other countries, and we want to make sure that with that money comes certain obligations, including protections of the rights and furtherance of the rights of people with disabilities for those foreign governments that receive our federal financial assistance. NCD has traveled to other countries to assist those countries that have ratified CRPD in their implementation and in their enforcement efforts. We've issued a number of reports on how international development efforts can be more inclusive. For example, we have recommended that the State Department, the U.S. Agency for International Development, the Peace Corps, and others develop diverse global advisory boards and committees to help support their disability inclusive work. Such groups have to include people with disabilities and contribute to that nothing about us without us approach to improve public and private partnership between United States foreign assistance agencies and disabled people's organizations abroad. Where our money flows, our values should be floating as well. And the core value for us is respect and dignity for the rights of people with disabilities abroad.
Thank you. Let's see, the next question. How can people get involved to support the NCD on its efforts in pressuring Congress to ratify the CRPD?
Jordan, I would encourage all the attendees here to, if they haven't already, to establish a relationship with their local federal representatives, right? And start having conversations with them, and see if there is an interest, engage what their interest is on promoting the rights of people with disabilities throughout the world. Certainly, there's been a number of reasons why the CRPD hasn't been ratified as of yet, and there seems to be a concern over getting involved and allowing the United Nations to make another declaration for which the United States may be subject to. But again, the United States can play a significant and decisive leadership position on these issues, and we're best positioned to do that. So I would encourage people who want to support our efforts to begin by establishing a relationship with their federal representatives and having dialogues with them, because ultimately it's going to be them. Those representatives are going to determine whether or not the treaty will be ratified in the Senate. So start having those conversations if you haven't. Start developing those relationships. It's going to be beneficial, certainly for the students in your career, if you have a good relationship with your federal representatives. But for this particular issue, I think the best thing that you can do immediately is to start having those conversations with your federal representatives.
That's good advice. Thank you. Let's see. So I know that you mentioned COVID particularly earlier, and this next question relates to it. So the last 2 years have been particularly challenging for everyone, but especially people with disabilities because of COVID. Can you elaborate a little bit more on how the NCD is involved in kind of closing those gaps in creating health equity for people with disabilities?
Jordan, as I mentioned, we're developing a framework. It has 30 discrete items. The top 4 items, which is really the foundation for the health equity framework. Number 1 is to have all people with disabilities identified as a medically underserved population. Now, what does that mean? There are provisions in the Public Health Service Act that allows certain minority groups and certain population groups to be designated as medically underserved populations. With that designation, it opens up a considerable amount of federal dollars that are housed in the National Institutes of Health to conduct research and to promote the research, not on examining the extent of health disparities, but to conduct research on addressing the existing health disparities that exist for the community that's designated as a medically underserved population. It allows for loan repayment and loan forgiveness for physicians, nurses, and other healthcare professionals that want to focus on caring for the needs of people with disabilities. It allows for a higher reimbursement rate for certain medical procedures that are performed for people with disabilities. And it just brings an all of government focus on the needs of people that are designated as medically underserved population. And typically, that designation has been reserved for particular groups that are housed in a specific geographic location. There's 64 million people with disabilities in this country in our territories. And so we don't fit the traditional definition of what would qualify for a medically underserved population. So we want to be designated as a special medically underserved population, or at least have each of those elements that I identified, those benefits of being a medically underserved population. We want those in place. And so we're pushing towards that. So that's number 1. Number 2 is that there must be curricula adopted within all of the medical schools and health professional schools that teach medical students and nursing students and others on disability cultural competency and what it means to be a person with disability in the United States, what it means to care for a person with disability, and how to discern one disability type from another, knowing that a spinal cord injuries and the needs of people with spinal cord injuries like myself are different from someone who has cerebral palsy, is different from someone who has MS, etc. You'll be shocked to know, Jordan, that of the over 1,100 medical schools that exist in our country today, there's only really 19 of them that have any kind of curricula that addresses the needs of people with disabilities. And that in the United States, a physician can become board certified without ever having seen in medical school, in their residency programs, or in any fellowship programs, the postgraduate work, ever having seen a patient with a disability. And you see this prominently within the intellectual and developmental disability disabled community, where many are continuing to be treated by their pediatricians, even though they're adults, because they can't find within their local community physicians that are trained and experienced in dealing with their particular needs. So the disability cultural competency curriculum must be developed, and it must be implemented and mandated to be taught in every medical, dental, health professional schools and allied health professional schools that receive federal financial assistance. The Patient Protection and Affordable Care Act, when that was signed in 2010, it contains a provision mandating the Secretary of Health and Human Services to develop this curricula, and that should have been developed in 2014, but there was never appropriations for that to be done. So we're pushing for that to be fully funded and for that curricula to be developed and mandated within those schools as well. The third item, which is core to our health equity framework, is to ensure that both the Department of Justice and the Office of Civil Rights for Health and Human Services adopt the standards for accessible medical diagnostic equipment that was developed by the U.S. Access Board in 2017. Again, in response to a mandate under the Affordable Care Act, the U.S. Access Board, which sets the technical standards for physical things that affect people with disabilities, including specifications on how wide a ramp should be into a building, the slope, how many doors must be physically accessible, the size of accessible rooms, hospital rooms, etc. Well, the U.S. Access Board was charged with setting standards for accessible medical diagnostic equipment. So that means height adjustable examination tables, height adjustable examination chairs, accessible mammography equipment, accessible diagnostic equipment. Jordan, you may be surprised to know, but if I'm not able to independently transfer from my power wheelchair onto an examination table, I get examined while I remain in my wheelchair. And oftentimes that's fine when there is, I have something that is affecting my upper body. But if I need a full and complete physical examination, one that you would receive or one that anyone else who's not disabled will receive, you would be transferred, you would be asked to sit on the examination table, lay down for certain portions of the examination. All that is performed while I remain in my wheelchair, which is to say, I don't receive the same thoroughness of an examination that someone who is not disabled would receive. And in many instances, hospitals and doctor's office do not have the equipment to safely transfer me from this wheelchair onto an examination chair. So the U.S. Access Board then was tasked with developing standards that manufacturers then could use to build accessible medical diagnostic equipment. And that has yet to be adopted formally by Department of Justice or the Office of Civil Rights for Health and Human Services. Department of Justice is responsible for enforcement of the Americans with Disabilities Act. The Department of Health and Human Services, as it relates to the healthcare professionals, is responsible for enforcing the Rehabilitation Act of 1973. Each mandate that recipients of federal financial assistance do not discriminate against people with disabilities. And when they don't have equipment to provide us the same comparable care that they provide someone who's not disabled, that is discrimination. So those two agencies then have to adopt those in their regulations for those standards to be binding. Right now, they're simply just voluntary. And then the last thing, Jordan, that is the cornerstone of our health equity framework is better data collection. There's scarcity of data regarding the public health surveillance issues affecting people with disabilities. We know that COVID has disproportionately affected people with disabilities, but we don't know yet the true extent because disability is not even captured on a standard death certificate in the United States. And there's a number of electronic medical record systems and healthcare systems that don't capture the status of a person's disability. So we need better data collection, and that's the core of our program as well. So those are the things. Plus there's 26 others that I can go on and on and on describing our health equity framework, but we'll be getting more information out to the public because we're going to need public support here shortly.
That's amazing. Andres, thank you so much for sharing all that information. It's very captivating. The health equity framework really does sound like something that is just so important. So in addition to this health equity framework, are there any other initiatives currently that the National Council on Disability is working on that like students could get involved with supporting?
Jordan, health equity, improving healthcare access for people with disabilities is our abiding focus, but it's not our sole focus, given all of the other issues that affect people with disabilities and really the shortened time frame that we think that we have with the existing federal partners to try to get things done. Obviously, stay tuned. There's many components of our health equity framework where we believe community involvement is going to be critically helpful. Again, having people contacting their federal representatives and asking them to embrace the NCD's health equity framework. But in addition to that, we'll be releasing our 2021 progress report. Every year we have a single report that is mandated to be released by October 31 to Congress on a broad policy issue that is affecting people with disabilities. And for this year, again, given where we are, we have focused on COVID-19 and its effect on the disabled community, how it affects them in education and employment, in housing, in healthcare, in transportation. And that report is going to be released at the end of October. From there, we're looking to engage the administration and the community on specific policy recommendations to avoid a repeat of what we've seen and what we've experienced. Next year, we'll be working on a report that that documents the effects of climate change and extreme weather conditions on people with disabilities. And so we're right now identifying the scope of work, and we will be issuing a request for proposal from different members of the community to submit a proposal for our funded research in this particular area. We're doing a lot of work in employment, trying to eliminate Section 14C of the Fair Labor Standards Act, which says that certain employers for certain people with significant disabilities can pay their workers pennies to a dollar per hour. They don't have to pay the minimum wage to these people with disabilities, and we want to try to get that changed and ensure that everybody who's employed who has a disability receives at a minimum the minimum federal wage of employment. But we're also looking to enhance the employment opportunities for people with disabilities by making sure that their benefits under Medicaid for support while they're at work are not eliminated as a increase in responsibilities and increase in compensation, so they don't lose those supports and allow them to progress naturally through the course of their employment, just like anyone who is not disabled. So there's a lot to do. I think there's There are significant opportunities for students to get involved. One, understanding what these issues are affecting people with disabilities. And I would encourage, again, all the attendees and all your students that are listening to visit our website at ncda.gov. And there you'll find just a menu of different topics and different reports that we've published in letters and initiatives and actions that we've taken since our existence. And I think that would be incredibly informational and educational for many of your students.
That's amazing. Thank you. Let's see. So our final question, let's see, what advice can you give university students just entering the field of counseling and rehabilitation?
So foremost, thank you. Thank you for entering the field. Rehabilitation counseling and psychological services are critically needed throughout the country and internationally as well. And whether you enter as a counselor providing one-on-one services, whether you engage in policy development for a city, for a county, or for a state, or whether you enter into academia to continue to teach others. I know that the rehabilitation counseling program at the university is incredibly strong. So know that you're receiving and being provided an exceptional educational foundation that will help you develop the professional understanding, the knowledge, the attitude, and the skills that you're going to need to assist individuals and groups of individuals with disabilities in achieving their maximum level of independence and functioning. We need many champions as we possibly can for people with disabilities. So thank you for pursuing this profession. I would encourage you, though, wherever you are, to get to know your local Center for Independent Living. They're going to be a tremendous resource for you once you are out into the field. But this is a local group of people with disabilities, an organization, nonprofit organizations that are federally funded, in part, and state funded, that are charged with teaching individuals and assisting individuals within their community with disabilities how to advocate for themselves, how to live the most independent and self-directed life as they so choose. So it's a great resource to have. They can certainly use your support in terms of time and financial support. But foremost, it's a great resource as you are developing your career as rehabilitation professionals in the community where you exist and where you are.
That's awesome. Thank you. Let's see. So it's roughly time if anyone in the audience would like to ask some questions. It's the time for that. So
great. And Jordan, I just hopped on with you. This is Kathy Johnson. Andrés, good to see you.
Kathy. Likewise.
Boy, if I had the opportunity to provide you an honorary doctorate from our university, I would do that today. What a wealth of knowledge, experience, and expertise. And I really, I think, when we ask, how can we get students involved? One of the very first steps is knowledge and awareness for taking action. And so we're really grateful for you sharing all about the National Council on Disability, and hopefully students will get more involved and have greater awareness also of the CRPD. And I loved having you share about the disability culturally competency curriculum development. Count us in. Amy, I hope you're not too busy, but Dr. Knopf and I would love to be a part of that. Beautiful. We do have some questions, so if I may ask those.
Please.
This one is from Steve Anderson. I assume the National Council on Disability is a nonpartisan. However, as a person with a physical disability, cerebral palsy, how can we as a disability community become more of a political force than what we are? Voting rights come to mind, the CRPD, among much more.
So that's a great question, right? Because as you recognize, and as the question intimates, and that is that, there's 64 million of us. If we were a voting pact, and if we were, considered, a group, a minority group, and formally recognized as such, then there would be a considerable amount of political leverage that we would have in this country, right? So there exists a national organization called the American Association of People with Disabilities, AAPD. AAPD is that unifying organization that the community and people with disabilities should get involved with. And they are serving as a strong voice and strong consolidated voice for all organizations and all people with disabilities. And they wield a significant influence on Capitol Hill. But, there's been some talk out of that 2010 convening that we had at the National Council on Disabilities. I've made just tremendous relationships and connections with various people, advocates, just stellar advocates throughout the country. And there was talk coming from that meeting of trying to get starting a nonprofit political action group for people with disabilities. So it never got off the ground, but it's not for lack of interest. So if someone's willing to take that on, then I think you can get great traction with that.
Okay, Steve, that was for Steve Anderson. He's from Hamline University. So Steve, take it on. Let's make it happen. Good recommendation. Okay, then we have another question from one of our students, Michael Libby. Earlier in the session, you stated you struggled with accepting your own disability. Do you have any advice for someone that might be struggling to overcome the negative condemnation because of their disability?
So look, everybody has their own journey. Everybody has their own path. I come from a Hispanic culture in South America where disability was not something that was embraced. It's not viewed as a natural part of the human condition. It's evolving now, it's changing, just given the sheer number of people with disabilities. But, anybody become disabled at any time. But at the point where I became disabled in 1996, I had previously internalized all the negative stereotypes affecting people with disabilities. And so, and I didn't see anybody in my profession that was disabled. There wasn't anybody with a visible disability in any of the meetings, any of the American Bar Association meetings that I would attend, where you would have thousands of attorneys throughout the country convening in one particular place. I never saw anybody with a wheelchair. And so when you didn't see yourself there, and also, I got to be honest, being a minority attorney, Hispanic attorney, I always felt that I had to prove myself. And now I was forced to be double hyphenated, not only Hispanic, but Hispanic and disabled, and as a young attorney. So it was very difficult for me at first. And that's because I did not know anybody else like me. And then once I started affiliating with Access Living, they showed me, not deliberately, not by anything they set out to do and say, this is how you embrace your disability, but just the issues that they were involved with and the advocacy that they were undertaking to help improve the lives of disabilities really allowed me to embrace my own disability and know that I'm not the only one out there. And where I tried to find a meaning for what happened to me in the accident, I found it being both an attorney and a person with disability, because it gave me just a tremendous platform, not only to advocate for myself, but to advocate for others as well. So, so that's a long way of saying everybody has to come, has to find a way to be in a position to embrace their disability. And it took me a good 6-7 years for me to do that. But once I did, all the obstacles that I perceived before as holding me back went away instantly. It's just because I embraced my own disability.
Right. Wow. Well said. Thank you. One of the areas, I have a question, if I may, that one of the areas that I think we still really struggle with, not only in the United States, but globally, is dealing with mental health as a disability. And so I'm the parent of a child with a mental health disability, and navigating the system to get her the help that she needs and needed. It is so overwhelmingly challenging. And so is the National Council on Disability having any, it's probably included in your health equity framework in some capacity, I would assume, but could you share about that?
So the needs of people with disabilities are paramount on our mind. The IDD community is one that we specifically identify as being a subset of the broader disability community that really needs to be designated as a medically underserved population, right? Because it is the lack of disability cultural competency, the lack of awareness and having any training in treating people with disabilities, treating people with IDD, that makes it difficult for them to find someone other than their pediatricians to provide care as they grow older with IDD. So yes, that's an important part of our framework. But we're also working on issues that affect police interaction with people with IDD, because that's a big issue. Here in Illinois, again, our Center for Independent Living in Chicago, Access Living, was instrumental in pushing legislation that was passed in Illinois just about a month ago that requires, when there's a mental health issue, that there be a mental health professional responding to that particular issue when a call is received via 911, instead of immediately having police out there. And I can get you more information on that statute, and that should be replicated in all jurisdictions as well. So we're looking at that, and we continue to have conversations with our federal partners on addressing those issues, but and also employment of people with IDD as well, and getting rid of sheltered workshops or the conditions of sheltered workshops that really keep people entrapped and receiving the sub-minimum wage that I mentioned previously. So there's significant amount of work that needs to be done in that area, as you know.
Yes, definitely. And I really appreciated you sharing about the legal system and how you saw no representation of people with disabilities, and how last week with my colleague Fred Maas, who I think is on here still, we had a conversation with Tony Coelho and learned about his center that is focusing on providing scholarships to young people with disabilities to enter into the legal, as a lawyer, legal work, and supporting and advocating for individuals with disabilities who end up in the legal system, and have a greater understanding of mental health, and that interconnection between mental health and then being in prison or jail or anything like that. It's just, there's a lot of need there, but this has just been wonderful talking with you and having you join us. And with your permission, we had this recorded, and we'll include this then into our video library for our whole series that we're doing. And so we look forward to also hopefully celebrating your birthday with you in Dubai.
I appreciate that greatly.
Yeah, so that will be our last big event for this whole series that we're doing together with Dr. Knopf. So Jordan, did you have some closing comments then for our webinar today?
Yes, I would also like to thank you, Andres, for sitting with us and sharing your wealth of information and knowledge. It was really great to have you here with us. I'd like to also thank everybody else who, was here live, and then anyone who watches. Sorry, I had my voiceover or the screen reader in my ear, but everyone else who showed up and watched. Let's see, if you would like to earn the CRC CEUs that I kind of mentioned earlier, I think we're going to post the link in the chat for the website where you can go and you can sign up for those. And let's see, the next session in the series will be on October 6th. It could be great if, everyone could go to that one too. It's with, I think it's pronounced Isabel Hodges, on the United States International Council on Disabilities. So go to that if you can. But thanks again to Andres and everyone for showing up.
Thank you for having me.
Thank you. Yes, thank you so much, Andres. We'll follow up with you soon, I'm sure.
Great. Thank you so much.
All right. Thank you, everyone, for joining us today. Please join us in 2 weeks for Isabel, as Jordan shared. Thank you to our interpreter, Amy Kalmas. Thank you. Okay. Bye-bye, everybody. Have a great day.
Be well. Thank you.
Thanks. Stay safe.
Thank you for watching Embracing the Difference Globally, the Ability event.